Garcia, and I'm on my way in to talk to Major General Murphy, our Trusted Care Senior Sponsor and Deputy Surgeon General, about the upcoming CARE campaign. Let's go.
Come in!
Hi, sir.
How are you doing, Major Garcia? It's a pleasure to see you. Have a seat.
Thank you. I'm here to talk to you about the CARE campaign.
You are?
I am. And it shows here on our badges on the CARE campaign principles that reminds us of our collective commitment to zero harm and how we can work towards that goal together.
But I keep the cards in here to make sure as it's bouncing that people understand the importance of trusted care and what we're doing in the CARE campaign. Because we all have to live this, and I can tell you right now, there's a lot of learning going on.
Things have seemed to change lately. I hear a lot of talk about S.T.A.R. What are your thoughts on that?
Well, I know the world's changed up here because the use of S.T.A.R makes everything more efficient and easier. And S.T.A.R is the situation, background, assessment, and recommendations. So I told everybody at half, I said, I will not take any emails that aren't in the S.T.A.R format. And the question's, why would you do that? Well, because the biggest part is it makes the individual who's sending the email think a lot more about the issue that they want me to help them with. Often we get emails with very little thought, quite honestly, about what they want the receiver to use. There's only so much time in the day. So when they can come down and put a good S.T.A.R and put a recommendation down, then that makes it very easy for me to just say, press, go do it. It really helps leading to that clear communication, right? The C in CARE. And S.T.A.R is that great tool to use. So that is just incredibly important, both for safety and for communication and working things that support the front line.
Sir, I see how valuable S.T.A.R can be. What do you think about other tools like attention to detail?
Yes. So when we talk about zero harm, there's no way to get to zero harm unless you have that attention to detail. So you can talk about attention to detail in the realm of a checklist for dental, for surgery, and if you do not follow that checklist, we harm patients. And when we've reviewed most of those cases, guess what's happened? A lack of the attention to detail, following the checklist, and that leads to harm.
And I'm thinking about one of the other features here on our badge about respect for teams. I know I feel more engaged and as part of a team, working together as a unit. What do you think about that?
So I don't know how you can run an organization, an effective organization, a high reliable organization without respect for others. When we talk about all teams, when we talk about what we're doing in the military health system, and as we move on and evolve as a military health system, without respect you have nothing. So when we talk about foundational needs in our system of high reliability, respect is an incredibly important one. And when you look about that respect, it also is so important, as I mentioned before, about listening. And listening also has to do with the E part of exercising a questioning attitude. Because if you're in a conversation or you're at a meeting with a lot of people and there's not respect, then people don't want to talk. And that's exact opposite of what we need when we put the foundation of a high reliability organization on the table. So it's everybody's responsibility to have that questioning attitude and to exercise it. So as we kind of close with Major Garcia, thank you very much for coming and sitting with us today and having a little conversation. It brings us to the contest that we're having in the AFMS and the How Do You CARE contest. We really want to see your behaviors and have you tell us about your CARE behaviors and what you're doing out there. We want your innovation, we want your creativity, and we want you to have some fun with this. So have a great Air Force Day, and we'll be looking forward to seeing those videos.
We're hosting a How Do You CARE video and essay contest, open to all AFMS staff, active duty, Guard, and Reserve, across all 7 corps, inclusive of officer, enlisted, civilian, and contractors. Videos and essays should answer the question of how you use the CARE tools in your daily work. The videos must be no longer than 2 minutes in length and essays between 250 and 500 words. Submissions will be accepted through August 31st. Winning videos and essays will be publicized on AFMS social media pages, recognized by the Office of the Air Force Surgeon General, and awarded a limited edition Trusted Care coin.